Your systolic and diastolic numbers have changed. Please welcome Dr. Gregg Silverman join us now. And an important number you should know, 3,000.
That's right. 3,000 calories is the average that people ate during Thanksgiving. So we were discussing this, probably 2/3 of it is pecan pie in my house. I can tell you that. It was terrific. But the new guidelines are out from the American Heart Association for blood pressure, and we have changed a little bit. We've gotten a little bit more aggressive with the blood pressure. That is, it used to be that a thing called pre-hypertension, but now about 130 to 139 is hypertension, where you have to discuss lifestyle modifications. That is, weight loss, dietary modifications. Certainly know your other numbers about cholesterols and those types of things, and start really getting aggressive with that. Anything over about 140 generally will deserve a blood pressure medicine, at least one.
And I mentioned this to you, more people will find out that they do have some kind of, like you are now falling within that threshold of danger.
Correct. That is above 140 now. We are starting to get more aggressive with this. They want everybody around less than 130. Although I'll be honest, in my own practice, it is not only difficult, but I think that some people actually do better at about 130. They do a little bit better, especially the elderly, where you have to worry about other things, syncope and weakness and dizziness and those types of things. It is okay. In my personal practice, I will let them go a little bit higher, but generally the general population has to start worrying about it at around 130.
I was going to ask, when these new guidelines came out, did a lot of your patients call up and say, hey, do I need to come in? Or?
No, because I think we already started, that's one of the things that we do in the practice is we really discuss blood pressure. We discuss blood pressure modifications and how to do that. That is, just about 10 pounds of weight loss will bring you generally off of at least one medicine. So understand those, understand your numbers, understand what happens if you get really high numbers. That is, if your blood pressures are above 180 or the diastolics are above 120, know what happens then and what you need to do about these things.
Okay, good advice there, Dr. Silverman. Man, we appreciate you. Thank you. And
well, thank you very much.
Glad you had a good Thanksgiving with pecan pie.
We had the pecan pie, we had the whole family, and we had a great time.
There you go. Well, somebody else's favorite holiday is Thanksgiving. That's Alan. Alan, I know you probably dove in on that those treats.
It's also my favorite pie too, pecan pie.
There you go.
That's good.